Hey everyone, I want to talk about a few key takeaways that I had for the past 2 weeks. One is SMA syndrome in malnourished patients, which is superior mesenteric artery syndrome. And what it is it's when your body doesn't have enough nutrients, that it doesn't have enough fat to protect your arteries and your organs. So what happens is your organs pushes the arteries that connect to your small intestines, and it can cause like mini strokes and different symptoms for a patient. So I thought that was super interesting. I heard that from the medical doctor in our team meeting. And then some other things that I experienced during session is understanding where the patient is coming from, understand their entire life and kind of where they are right now and how they've gotten there. So understanding the diet culture that kind of goes into play with eating disorders and their life and how they were raised. So I worked with a few patients, and hearing their story of, the yo-yo dieting or the restrictive behaviors based off of appearance. So thinking, having this assumption that they're fat when in reality they're malnourished and they're not getting enough nutrients to their body, and just like seeing the different way that people's brains are kind of reacting and how mental illness can also play a role into that has just been super interesting, and it's just been a super big learning process for me as I continue to grow in the eating disorder field. Like, this is what I want to do. So understanding these things and how to work with a patient with nutritional needs is super important. So just learning all of this and coming together is it's been eye-opening.